The question for today is: a 5-year-old child presented with history of failure to thrive and repeated episodes of diarrhea for the past 1 month. Lab investigations reveal steatorrhea, and the peripheral smear and the intestinal biopsy findings are shown below. What's your diagnosis? Celiac disease, Whipple's disease, A beta lipoproteinemia, microvillus inclusion disease. So now look at the question. It's basically a child. Okay, so you have to be very careful when you're going to interpret any lesions in a child. So it's been there for quite some time. So the child is having failure to thrive, and there is diarrhea and steatorrhea. So in addition, you have a peripheral smear findings and the small intestinal biopsy findings. First, let's look at the peripheral smear, what it is showing. So what you have here is the RBCs with spikes on the surface. So you have irregularly spaced thorn-like projections. So these are nothing but acanthocytes. So acanthocytes means cells with thorn-like projections on the cells. So acantho means thorn, right? What is this biopsy showing? So this is your epithelium. Okay, so here you have these blue colored cells. What you can see here is you have some empty spaces or vacuolization of the epithelial cells. So where do you get these empty spaces? So when you're going to process the tissues, you have a lot of empty space, which could be due to accumulation of fat. So to confirm that those empty spaces are just fat, you can do a special stain like oil redo or any other fat stain, right? So on a background, so you have a child with a diarrhea, steatorrhea, acanthocytes, and accumulation of lipids in the intestinal epithelial cells. So your diagnosis here is A beta lipoproteinemia. Okay. So I'll tell you what is A beta lipoproteinemia. So the name is self-explanatory. A beta lipoproteinemia. Okay. So it's absence of beta lipoprotein, that's called A beta lipoproteinemia. So what happens when you have absence of beta lipoprotein? So this is a transport protein which is going to transport your lipids. So why do you have absence of A beta lipoprotein? Because you have a mutation in a gene called MTP gene, that's called microsomal triglyceride transfer protein. Microsomal triglyceride transfer protein. So because you have mutation in this gene, you don't have lipoproteins. Because you don't have lipoproteins, your lipids are not transported. So because your lipids are not transported, they accumulate in the intestinal epithelial cells, which can be highlighted by fat stains. So what is this lipids to do with your membrane abnormalities in RBC? So you all know the cell membrane is a lipid bilayer. It's a lipid bilayer. So when you don't have these proper lipids, your RBC membrane will start showing spikes on the surface. So that's the reason why you have accumulation of lipids and RBC membrane abnormalities. Other things, because you don't have these fats, your fat soluble vitamins are not absorbed. So you have other features like steatorrhea, and you can have diarrhea. So this is about A beta lipoproteinemia. Now going to the other options, celiac disease. That can still occur in a pediatric age group, but you have a lot of lymphocytes, intraepithelial lymphocytes. So you will have lymphocytes inside the epithelium, lot of intraepithelial lymphocytes. So Whipple's disease, it's an infectious disease. I've discussed this in a video already. So what happens in Whipple's disease? You have a lot of foamy macrophages in the lamina propria, which has got the organism Tropheriма whipplei. So what is this microvillus inclusion disease? So it's been included in the recent edition of Robbins. So it's a type of congenital disease wherein in the epithelium you will have villi, right? So if you take this as epithelium, you will have lot of brush border, you will have microvilli. So you have problem with this villi due to certain mutations, that we call it as a microvillus inclusion disease. So you have to go for a total parenteral nutrition, because your villi are abnormal, your absorption will be defective. So that's about your microvillus inclusion disease. Thank you.